I didn't have this necessary drive to become an entrepreneur. I was very happy being a doctor, but I found a lot of issues working in my own life with the recruitment processes for doctors. And so I fell into the solution that we built today, which is really building a two-sided marketplace that connects doctors directly with healthcare facilities. I still work intermittently as a clinical doctor all across Australia, mainly as a locum, which is like a contract worker in regional and remote hospitals. In 2023, I started the idea for a company called StatDoctor. We're a B2B software solution for healthcare facilities, allowing them to find, hire and pay doctors faster than going through recruitment agencies. And then as part of that connection marketplace, we're building software solutions for doctors as well. We allow them to find work, but then also communicate, connect, bring in all of their development and education into one easy-to-use phone app. Part of our value proposition to healthcare facilities is we have no temp to perm contracts, so we don't charge you. If a locum doctor comes to a rural town, really loves it, we don't charge for them to be converted to a full-time worker. A typical recruitment agency will charge somewhere between $20,000 to $80,000 dependent on the skill set of that doctor. Most of our problem comes from trying to get doctors to download us in the first place and competing with the other 100 recruitment agencies for getting doctors' eyes on their platform on a marketing level, on a founder level, on a business level.
What triggered you then to say, I'm going to turn this into an app and start a business around it? What was that moment?
It reminds me of the company Granola. I don't know if you've ever heard or used that.
I've started seeing a lot of their ads recently.
Yeah, they initially said that they were an AI kind of transcription software, but they were just listening in and writing things by hand and summarizing it in the first part. I think it was 2 guys in their uni dorm room surviving on ramen. And now they've just raised millions of dollars and have a huge valuation and everyone loves them. And the thing I liked about that incubator program is it was done on your own time. So I was still working full time as a doctor. I had 0 hours during the day and I was an ED doctor. So I was working days, mornings, afternoons, nights. My schedule was everywhere. So they provide you like this back-end Notion education platform that you work through at your own pace. And by the end of that program, they provided me some simple wireframes, a little bit of a logo, how to kind of structure a business, how to build out like simple sales pipelines, operational pipelines, etc. So it's easy to think, I spent a lot of money on dev, and nowadays I could probably get the same dev for, $1,000, $2,000. But the thing is, back then it wasn't available, and 2, particularly in healthcare, health tech, you can't vibe code a product without knowing what's going on.
A lot of people say that they're actually scared that someone's going to steal their idea. I'm like, I have a hard enough time running my own business, let alone trying to build yours.
Yeah, exactly. We can't be draining good resources from particularly rural towns. If a doctor wants to work there, we should encourage it, not penalize them. And this is something that I tell a lot of newer founders, particularly I do a lot of advocacy for the clinician-led founder space, trying to encourage doctors, nurses, allied health practitioners to start their own businesses. And the part that I think I got wrong or didn't do as well as I could have was I didn't identify